Good afternoon. The Premier and our Health Minister have asked me to address some of the common questions that Queenslanders have got at this time. I think it's extraordinarily confusing for people as how best to protect themselves, their families and their community from this novel coronavirus. It's novel, it's brand new, we don't know a lot about it, but every single day we're learning more and more. So this afternoon I hope to share some of that information with you, because I know that Queenslanders are always responsive when they get the information and they understand what it's best for them to do. It's when there's a vacuum of information that we see things happen that we'd prefer not to. So I'm happy to take any of your questions, send them in and we'll go through them. I'm going to start with a few that people have already asked to get things going, but as soon as your questions come through, I'll manage yours. And if we don't get time for them, because I understand we've got around half an hour for this afternoon, then we'll keep on answering them online. So just keep sending them. It's really important, because if you've thought of a question, I can bet you there are a lot of other people out there who've thought of exactly the same question. So let's get underway. I've got someone helping me here who's getting all the information offline and giving it to me so I can then read it out. So I'll read the question out and then do my best to answer it so that everyone can follow. Thank you. Right, the first question, how do you catch coronavirus? That's really important. It's a respiratory virus, which means it is spread when someone coughs or sneezes. So they cough or sneeze those particles out into the air, and if you're closer than 1.5 metres, you can then inhale them, or they can drop down onto hard surfaces like this table, other surfaces, and then people can go along and touch their face, because everyone touches their face all the time. You can't not do it. It's really, really hard. And that's why I've been out there messaging to people to just regularly wash your hands. Wash your hands before you eat, of course, but wash your hands whenever you've been out touching surfaces. Soap and water's always the best, but if you don't have access to soap and water, then some of those hand gels are pretty good as well. But soap and water's the best. Next question. Do I need to cancel all my plans? No, we should, at this point in time, keep on with our normal business. I would strongly recommend, as our Prime Minister has done already, that you don't go overseas. We know that there are a lot more cases overseas in a lot of countries. There's around 153 countries around the world that now have the coronavirus circulating freely in their country. So you're at much higher risk if you go overseas. And also you won't have a health system that you can rely upon overseas. Often you'll be in a country that you don't speak the language of that country, you don't know how the health system works, you won't have your support network of your family and friends. So my suggestion is don't go overseas at this point in time unless it's absolutely critical. Of course there's always exceptions and you've got to work through them, but I wouldn't be going overseas for non-essential travel. But here in Australia, keep doing what you normally do. Go about your work, go to the shops, go with your kids out and play in the parks. Do everything you would normally do. A lot is closing down due to those restrictions now for gatherings of more than 500 people, or within your own home, or out in the community of 100 people. So we don't want 100 people gathering indoors, 500 people outdoors. So those sorts of events have been cancelled, but other things are still fully open, operational. So do what you normally do. And another one. Are children asymptomatic carriers? Someone really knows what's going on here. The first thing is that everyone needs to know that children, and this is a really big difference between this coronavirus and flu, is children are tending to get very mild disease. So it might seem like they're asymptomatic carriers, but it's not really. They've just got mild disease. So take note of your kids. The good thing is I know that parents know when their kids are sick. I've always known that. As a doctor, when I was working in hospitals, I always paid attention to the parents because they would tell me. They'd say their child was really sick. Maybe to me, I didn't pick up some of the signs, but the parents knew. So as parents, look at your children. You'll know whether they're sick. And if they're sick, get them tested and keep them at home so they're not out there spreading infection. Don't let them go to school, keep them at home. But we know that when children get this infection, they're getting mild disease. They're not getting catastrophically ill like young children do, particularly those under 5, when they get the flu. It's quite a different disease. So no, they're not asymptomatic carriers, they're just having very mild cases, so people are missing some of the signs. So believe yourselves, as parents, you know what you're doing. And another one. Oh, and that question, it was an excellent question, was from Linda. And this question is from Hardy. What if I feel like I'm getting sick? Do I go to the doctor? Well, you probably know your own body. If you feel like you're getting sick, stay home and you'll very soon know whether or not you've got this novel coronavirus. So pay attention. Again, Hardy, a very sensible question. Just everyone, just stop and pay attention to your own body and your own signs and symptoms. In China, there were quite a few people there who didn't recognise they were sick because they were exhausted, and they were confusing the signs of being exhausted and the signs of the illness. So just pay attention, and if you feel like you've got aches and pains, cough, you're sneezing, fevers, that's time to go and see the doctor. But if you don't have symptoms, that's not the time to go and see your doctor, because we can't test you if you don't have symptoms. We really need to test you when you've got symptoms, because that's when you'll have the virus. Taurine, will I still be able to go to places? For example, with my family or friends, or go to a cafe for lunch. Of course you can do that. So as long as you're not one of those people who's been asked to go into home quarantine because you've returned from overseas, or you've been in contact with a case, or you're a healthcare worker who's unwell, or an aged care worker, as long as you're not one of those people and we're asking them to go into home quarantine, or you're not sick and a confirmed case with the novel coronavirus, we're asking them to go into isolation, all other people can still go out to places. Now, you'll see a bit of a change. When you go out to cafes, to bars, to clubs, to pubs and so forth, they'll be decreasing the number of people in spaces. So there's less than that 100 people. Because we know it's the number of interactions you have that's a risk. So you can just imagine, it's just a numbers game. So if you come into contact with 20 people in one day, you're going to have 20 times the chance of picking up this virus than if you come into contact with one person. So that's why we're limiting the number of people in outdoor functions to less than 500 and the number of people in indoor functions to less than 100, just to try and minimise the numbers of contacts people have. That's an important thing to think about, and of course it's most important for those people over age 60 with one or more chronic diseases. Things like diabetes, high blood pressure, heart disease, lung disease, all of those things increase the risk. It's age and one of those conditions. They're the things that increase the risks. So if you fall into that group, maybe think about staying at home a bit more, getting your family to help with the shopping so you don't need to go out, and minimise your contact with people. Use the phone, use Skype, and do those sorts of things. And if you're in an aged care facility, it's particularly important. So really think about when you're visiting your elderly relative in an aged care facility, if you've got any symptoms at all, don't go and visit. Pick up the phone and be careful, and don't take young children to visit if that's at all possible, because we know, as that earlier question said, that they can transmit the virus although they still don't really have any significant symptoms. Alison, is the coronavirus like the flu? This is probably the most difficult thing to understand. It's not. It's a respiratory virus, but it's very, very different to the flu. There are a whole lot of things that make it different. The first one, and the major one, is we don't have a vaccine. So we can protect people against the flu by vaccinating. And this year, it's critical that everyone go out and get vaccinated once the flu vaccine's available, because we don't want people to get the flu vaccine, and the flu virus, and at the same time get the coronavirus infection, because two viruses together at the same time are not good for anyone, because you've got an increased risk of getting worse disease. So that's our biggest difference. We don't have a vaccine. There are a lot of very, very clever scientists, some indeed at the University of Queensland, working on getting a vaccine as soon as they possibly can, but we suspect it's going to be at least 12 to 18 months away. So we don't have that, which is why all these social distancing policies, as they're called, are being brought in to minimise contact, to minimise spread, because that's our best defence against this virus. There are some other things. We know that it's a more serious virus, that those people over age 60 will get more serious disease, and unlike flu, children won't get a serious disease in most cases. And then the other big difference between the two viruses is that pregnant women are not getting serious disease as they do with the flu virus. They're getting disease at the same rate as non-pregnant women, which is another good thing. But it is a different virus, and this particular coronavirus is brand new. That's why it's called a novel coronavirus. So no one has immunity. All of us are susceptible to it. Whereas with the flu, we last had a pandemic in 2009, and even then older people had protection because they'd previously been infected with a similar strain. It was younger people who got sick. This time, no one has protection. So, Natasha, are we safe to continue swimming lessons? Yes, you are. So, local government has been working to make sure that their pools are appropriately disinfected, and when they've had a known case, they have gone and superchlorinated to be particularly careful. But yes, you are safe to continue swimming lessons. Particularly, I don't know, Natasha, if you're referring to children, but yes, they're fine. For older people, it's actually the congregation of having lots of older people together that's more a risk than the swimming pool. So it's there being careful about having people who are at risk, to think maybe whether they need to socially distance themselves a bit more from the other people. But for children, if that was who you were referring to, yes, at this point in time, it's totally safe to continue swimming lessons. And Akil, are people with reactive airways or respiratory allergies especially at risk compared to the general population? Really, it depends. If they've got chronic lung disease, yes, they are more at risk, particularly if they're over age 60, or for our First Nations people, Aboriginal and Torres Strait Islander people, once they turn age 50 with any chronic diseases, they're more at risk. So they're the key groups. It's age and chronic disease that's the really big risk factors. But people should always be alert to all of their health conditions, and there will be some younger people who have severe lung disease who are at a higher risk. So they should be careful, and they should think about those social distancing mechanisms as well. And Peter, what is the best way to minimise risk in a shared office? Well, here, be careful. Make sure that if you're sharing desks, have some wipes and wipe them down between use. So if you're hot desking, coming in and sharing a desk with other people, just give them a wipe down. Most offices would have that 2 square metres per person, so you maintain that 1.5 metre distance between people, and that's a good amount of social distancing. So if you can try to maintain 1.5 metre distance with other people, that's probably the best. But if you are hot desking, just have some of those wipes, and this virus is very easily killed. It's not a difficult virus to kill on surfaces, so that's always a good thing to do. And Rahul, I want to spend time with my parents who are in their 60s. What preventative measures can the whole family take to not infect each other? Well, this is important. We should always, of course, spend time with our parents and our grandparents. That's very, very important. One thing to think about is perhaps for children to not spend this time with older parents and grandparents who have chronic disease. Just think about the risks that your older relatives have. If they've got chronic diseases, then maybe it's time to think about the kids talking to them via Skype or via phone, or maintain that 1.5 metre distance. And whatever you do, if someone's sick, don't visit your older relatives. That's the most important thing. Then the other thing is to support your older relatives. So look, if they're at home, maybe do some shopping for them so they don't have to go out and mingle with lots of other people. So they're really only mingling with their close friends and relatives rather than the general population. So just think about those sorts of things. David. I've controlled high blood pressure. Does this put me in a high-risk group? Well, David, it really depends on your age. If you're over age 60, it does. So you should be cautious about your interactions and about how much social mingling you do. If you're under age 60 and it's controlled high blood pressure, you're not really at any increased risk. And Dan, what's the advice for immunocompromised children? We've not seen a lot of evidence of severe disease in that group, but having said that, I think it's important to be cautious. And I think really for immunocompromised children, you'll have a normal doctor who looks after your child. Go and talk to them and see what they say. They'll be able to advise you rather than taking general advice. It's a very important question, Dan, and something to go and look into with your own doctor. My housemate has just come back from overseas. Do I need to self-isolate too? No, you don't. But if you come into contact with your housemate and contact is determined as more than 15 minutes of close one-on-one exposure or more than 2 hours in the same room, if you come into contact with them in the 24 hours before they become sick, if they become sick in that period when they're in quarantine, or once they're sick, then you'll also then be asked to go into home quarantine for 14 days after you last came into contact with them. So it's totally up to you. You can risk it and just continue to engage with them. You can still go about your normal life, but if you've had close contact with them in that 24 hours before they get symptoms or subsequent to that, you'll be going into home quarantine as a close contact. If you maintain a distance from them, so you don't share a room with them, and they, for instance, have their own bathroom, their own room, and they use the kitchen at different times to you, and you use some wipes and things to wipe things down, and you don't have close contact, then if they do develop the infection, depending what the public health people who speak to you as a close contact decide, then you mightn't need to go into home quarantine. So from Ben, if I genuinely believe I have it, should I be emailing my doctor rather than going to their surgery? It's really up to the processes that your doctor has. Most doctors are saying to me they would far prefer that their patients ring them. But some doctors, I'm sure, have an email process. But yes, you're quite right, Ben. You should contact your GP surgery and ask what they would like. Most GPs are very, very able to assess and manage anyone who comes forward for assessment thinking they may have the novel coronavirus, but some GPs, for whatever reason, don't have that capacity, and they'll be referring you somewhere else, either to another general practice in that location or to the local hospital to go to a fever clinic. So it will vary, so it's always important to ring, or if your GP has that facility, to email. Then the other thing is that some GPs have set up video conferencing Skype, FaceTime type arrangements so that they can talk face to face with their patients and their patients don't need to come to the surgery. And the Commonwealth has organised a Medicare item to cover that. And we've already seen in Australia over 30,000 interactions between GPs and patients being done through that video conferencing, Skype, FaceTime type arrangement. So check with your local GP, your own GP, what they want to do and what they are doing. Very good question. Thank you, Ben. Now, Jennifer, if my child had Influenza A at the end of last year, does that make them high risk? Well, unless they've developed ongoing respiratory complications, so they've got ongoing lung disease from it, no, it doesn't make them at high risk at all. It wouldn't change their risk. They will still need to, if they're under age 5, it would still be wise to get the flu vaccine, because the flu vaccine covers all 4 strains and they've only had 1 strain last year, depending which Influenza A strain they had. So no, unless they had ongoing complications, if they recovered fully from the flu last year, it doesn't put them at higher risk. And Mon, my 9-year-old son and I live with my 77-year-old father. How do I know he's not asymptomatic and bringing home an infection? You, as the mother of your son, will know your son. You're the best judge. But if you're concerned, try and in your house, if it's possible, separate your young son from your older father. I don't know if your father, he's certainly in the age category, I don't know if he's got any chronic diseases. If he does have any chronic diseases, such as high blood pressure or diabetes or heart disease or lung disease, then it would probably be best to try and separate him from your 9-year-old son, if that's possible. But certainly keep a very close eye on yourself and your son if either of you get any symptoms, and then it would be best to separate yourselves from your father. Remembering that at this stage in Queensland, we've only got some early evidence of some transmission in the community in the Gold Coast, not the rest of the state. So it's probably more important if you live in the Gold Coast than if you live in the rest of the state. That's changing, of course, as this pandemic spreads through our country. Giselle, the number of cases are not flattening out. Why are we not doing things quicker to make this happen? We're still in the early stage of this pandemic, so we're seeing the cases increase. It's when we see the peak that we'll want to see them flatten out. And that's why all this work is being put in place to increase the amount of social distancing. To stop those events of more than 500 outside, so we don't get mingling of large numbers of people, to decrease the numbers of people gathering inside, and to put that social distancing in place of maintaining a 1.5 metre distance with the people around you. So that's sort of that length of your arm, 1.5 metres. So they're the things that are happening to, as you say, flatten the curve when we get those numbers and they start to peak, so that peak is lower. And the reason we want the peak to be lower is so that our health system can provide the best care to every single person who gets unwell. So for those people who become critically unwell, that we can provide the intensive care services that they need. So that's why we want to flatten that curve, and that's all the work that's happening. The most important thing we can all do, and Queenslanders are doing brilliantly at the moment, is if we get sick and we're one of those key groups, so we've been overseas in the last 14 days, or we've come into contact with a confirmed case in the last 14 days, or we're someone looking after vulnerable people, we're a healthcare worker, an aged care worker, then it's really important to get tested for the novel coronavirus. And for anyone who's tested positive, it is absolutely critical that they're isolated at home if they have a mild case, in hospital if they have a severe case. That's important, and that they think about who they've been in contact with so that when the public health officer speaks to the person, that they're able to describe where they've been and who they've been in contact with. And we want people in the first day when they get symptoms, if they're in one of those 3 groups, to come forward. So that's when memories will be best. And we always contact trace back for the 24 hours before the first symptom, because we know that there can be some transmission in that period. So that's why we ask people for that information. My flatmate doesn't think this is serious. What should I tell them? Well, I'm going to make an assumption here that your flatmate is young. And yes, I absolutely agree. For 80% of people, this will not be a serious disease. It'll be quite a mild, self-limiting disease. Stay home, a bit of rest, and they'll be fine. But for 20% of people who get it, it will be a very severe, indeed critical disease. And we know that unfortunately some people will die. So that's why it's really important that everyone take this very, very, very seriously, because our aim is to save every Queenslander's life. We don't want anyone dying from this. And I know Queenslanders are always so responsive. We see it every year during our summer season when we have floods and cyclones. People are so protective of their fellow Queenslanders. If I have to self-isolate, can I still duck out to the shops for supplies? No, please, please, please don't do that. We've got so many people who can help you. If you can't get supplies through your own networks, your friends, relatives, next door neighbour or online, then please just ring up 13 Health and they'll organise the Red Cross to help you. And also our Pharmacy Guild has been brilliant. They've organised home delivery for people who are in quarantine or in isolation to be able to get supplies of their medications. So if you need medications, ring 13 Health, they'll sort it out. If you need food, ring 13 Health, they'll sort it out with the Red Cross. If you need advice because you're unwell, ring 13 Health. The only reason you should be coming out of home quarantine or self-isolation for home quarantine is because you've done 14 days and you're perfectly well. You can go off your normal lives, no problem. If you're sick with isolation, you'll need to speak to 13 Health and they'll sort that out with you once you don't have symptoms, and you'll be contacted regularly. But people cannot come out of self-quarantine or self-isolation until they're cleared. That's really, really important. That's the best way of protecting our community. Can I get a doctor's certificate for work or uni if I'm self-isolating? If you're self-isolating, you'll be given a certificate when you're better. If you're self-quarantining at 14 days, if you're well, you can just go about your normal business and you can just show that quarantine order that you would have received at the border or you would have received because you're a contact, and you can show that it's 14 days since you were given that order, and if you're well, you're fine. We know that by day 14, if you have the novel coronavirus infection, you'll be sick and you will know that. From Lara, how can I wash fresh fruit that other people may have handled at home before consuming? So you can just wash it and then wash your hands after you've washed it. That's absolutely fine. And that's just normal hygiene when buying fresh fruit and vegetables. It's always good practice to wash them. Can I get coronavirus from takeaway food deliveries? Not from the food, as long as it's been produced safely, and we know that our local government is always very good at ensuring that our food in all of our restaurants and takeaway cafes, etc., is produced under safe circumstances. Well, I think unfortunately that's all we've got time for. But look, they have been brilliant questions from so many different people. There's obviously a lot of knowledge that people want to learn about. Go to our website. The Queensland Health website will give you lots and lots of knowledge, and keep the questions coming in and we'll make sure we add them to our frequently asked questions. So thank you all of you for doing all of that work. It's been extremely useful. Have a good afternoon.